Stop. Look at your hands right now. Are your fingers ever cold, even in a warm room? Do your nails look a little blue? Or do your palms flush red out of nowhere? Most people would say, it's nothing, just getting older. But what if your hands were actually trying to warn you about your heart? Because here's the truth that doctors are seeing more and more every single day. Your hands may be sending silent signals that your heart is in trouble, and almost nobody is paying attention. My name is Dr. Julian Rhodes, and I've been practicing medicine for over 20 years. And what I've learned, what I see confirmed in my office every single week. Stay with me, because what you're about to learn could genuinely change or even save your life. Welcome back. If you're new here, this channel is all about helping you understand your body better so you can take control of your health before something goes wrong. Today, we're talking about something that millions of people overlook every single day. Something hiding right in plain sight. Your hands. Now, I know what you're thinking. What do my hands have to do with my heart? A lot more than you'd expect. The heart is your body's engine. It pumps blood through 60,000 miles of blood vessels, reaching every single finger, every nail bed, every tiny capillary in your palms. So when something goes wrong with your heart or your circulation, your hands are often the first place the warning shows up. The problem? These signs are so subtle, so easy to dismiss, that most people chalk them up to stress, cold weather, or just getting older. But ignoring them can be a fatal mistake. Today, I'm going to walk you through 7 things your hands might be doing, right now, that could point to a serious heart or circulation problem. Let's get into it. 1. Persistently cold hands, even when it's warm. We all get cold hands in winter. That's completely normal. But here's the red flag. If your hands are frequently cold, even when the room is warm, even after rubbing them together, your body might be telling you something serious. When your heart isn't pumping blood efficiently, the body protects its vital organs by redirecting blood flow away from the extremities, your fingers, toes, and hands. This is called poor peripheral circulation, and it's one of the earliest signs of heart failure or arterial disease. What to watch for? Cold hands that don't warm up, combined with fatigue or shortness of breath. 2. Blue or purple tinge on fingertips or nails. This one is harder to spot, but once you know what to look for, you can't unsee it. If your fingernails or the tips of your fingers ever take on a slightly blue or purple color, especially after light activity or in a warm environment, this could be a sign of cyanosis. Cyanosis occurs when the blood circulating in your body doesn't carry enough oxygen, and the heart is the organ responsible for keeping your blood oxygenated. In healthy people, fingernails should be pink. A blue or grayish tint, even briefly, is a sign that your blood isn't getting enough oxygen. This is one sign you should never ignore. If you see blue nails without an obvious cold weather cause, talk to a doctor immediately. 3. Swollen fingers or puffy hands, especially in the morning. You wake up in the morning, try to put on your ring, and it won't go past your knuckle. Most people blame it on salty food or a bad night's sleep. Sometimes that's true. But if your hands and fingers are frequently puffy in the morning, especially around the joints, it could indicate fluid retention. When the heart isn't pumping blood properly, fluid can begin to accumulate in the tissues. This is called edema, and the hands are one of the most visible places it appears. Heart failure, kidney problems, and venous insufficiency can all cause this type of swelling. Key question: is the swelling also appearing in your ankles or feet? That combination is a classic warning sign of heart failure. 4. Clubbing of the fingers. This one is less common, but it's one of the most medically significant signs on this list. Finger clubbing is when the tips of your fingers become wider and rounder than normal, almost like little drumsticks. The nail curves downward, and the tissue underneath becomes thick and spongy. Clubbing develops slowly, often over months or years, which is why people miss it. It can be a sign of chronic low oxygen levels in the blood, which may be linked to congenital heart defects, certain heart infections like endocarditis, or severe lung disease affecting the heart. If you notice your fingertips slowly changing shape, please see a doctor. This is one of the body's most serious structural warning signs. 5. Unusual redness or flushing in the palms. Have you ever looked at your palms and noticed a strange redness, especially around the edges of your hand or near the base of your thumb? This condition is called palmar erythema, and while it can sometimes be harmless, it is also associated with liver disease and certain circulatory disorders that put strain on the heart. When the small blood vessels near the surface of the skin become dilated or inflamed, it shows up as redness in the palms. It can also be linked to high estrogen levels, rheumatoid arthritis, or as a side effect of some medications that affect the cardiovascular system. On its own, red palms aren't necessarily alarming, but combined with other signs on this list, they deserve attention. 6. Weak or painful grip strength. Here's a sign that most people would never connect to heart health. Studies published in major medical journals, including The Lancet, have found a strong connection between weak grip strength and increased risk of heart attack and stroke. In fact, researchers tracked over 140,000 adults across 17 countries and found that every 5-kilogram decrease in grip strength was linked to a 17% higher risk of cardiovascular death. Grip strength is essentially a measure of your overall muscular and circulatory health. When the heart isn't pumping enough oxygen-rich blood to the muscles, weakness follows, and the hands often show it first. Simple self-check. Can you open a jar easily? Squeeze with a firm grip? If not, and you're under 65, it's worth discussing with your doctor. 7. White, red, or blue color changes triggered by stress or cold. This final sign is striking when you know what it looks like. It's called Raynaud's phenomenon, and it causes your fingers to change color in response to stress or cold temperatures. They go white first, then blue, then often red as blood flow returns. For many people, Raynaud's is a standalone condition, but in some cases, particularly when it appears for the first time in people over 40, it can be a marker of an underlying autoimmune condition or connective tissue disease that can affect the heart. If your fingers regularly go white or blue when you're stressed or cold, even mildly, it's worth having a cardiovascular evaluation. This is especially important if you also experience chest tightness, unusual fatigue, or dizziness. Now, here's what the medical community wants you to understand. According to the American Heart Association, cardiovascular disease is the #1 killer of both men and women in the United States. And the most dangerous thing about it? The early symptoms are almost always quiet, easy to dismiss, easy to rationalize away. Doctors consistently report that patients come in too late, after months or even years of ignoring signs their body was clearly displaying. A study published in the Journal of the American College of Cardiology found that patients who noticed and reported peripheral symptoms early, like hand swelling, color changes, or cold extremities, and sought evaluation, had significantly better outcomes than those who waited. The hands are your body's dashboard. When warning lights appear, you don't tape over them and keep driving. You pull over. You get checked. None of the signs I've shown you today are meant to cause panic. Most of them, in isolation, may have simple explanations. But if you're seeing 2 or more of these signs, especially alongside fatigue, chest discomfort, or shortness of breath, please make an appointment with your doctor. This week, not next month. Early detection is the single most powerful tool we have against heart disease. Let's do a quick recap of the 7 hand signs that could indicate heart or circulation problems. 1. Persistently cold hands, even in warm environments. 2. Blue or purple tinge on fingernails or fingertips. 3. Puffy, swollen fingers, especially in the morning. 4. Clubbing of the fingertips, a slow, serious structural change. 5. Unusual redness or flushing in the palms. 6. Weak or painful grip strength. 7. Color changes triggered by cold or stress, Raynaud's phenomenon. Now, here's what I want you to do right now. Look at your hands. Really look at them. And think about whether anything on this list sounds familiar, for you or someone you love. Knowledge is the first step. Awareness is the second. Action is the most important. If anything on this list concerns you, don't wait. Talk to a healthcare professional. And if this video helped you or made you think, I'd love for you to do 3 things. Hit the like button. It helps more people find this information. Subscribe so you never miss an important health video like this one. Share this with someone you care about, because this might be exactly what they need to hear today. Drop a comment below and tell me, did any of these signs surprise you? I read every single comment. Until next time, take care of your heart. It never stops working for you.